Hi, I'm Allison Miller, and I wanted to take a second today to talk a little bit more about the Yoga for Cancer method and the props. And we use props pretty heavily in the Yoga for Cancer method because it is a way of making the practice more safe and more effective for you. So there's a number of videos on my website, and you'll see they're all labeled Yoga for Cancer, and there's different themes as far as immunity and bone building. And this is just a nice kind of intro video to watch to help you maybe understand a little bit more about what props we're using and how we're going to use them. I may not fully explain in every one of those practices how and why we're using the props that we are. So this video will help you learn a little bit more about how and why. The first thing that I'm not going to talk too much about is a yoga strap. And this will be used at different points possibly. And this could be a belt or a scarf. For each one of these, I don't want you to feel like you have to go buy anything, but just think of things around the house that might work. And the strap is just going to be used to, say, reach your foot. If we're lying down, reaching a leg up or something, we might use the strap to wrap around the foot and bring your hands kind of into a position, lengthen your hands. For the most part, yoga props are going to be used to help us reach. So the other main props that I want to really focus some of my talk on today are either yoga blocks, it could be paper towel rolls, or a chair. And these are a big part of the method and a big part of the reason why this practice is going to be safer than just walking into a normal yoga class and saying, I'm going through chemotherapy, radiation, or I recently went through. These modifications that we do to the yoga poses, including these props, are going to help make the practice safer for you wherever you're at in your journey through the cancer process. So the idea here with paper towel rolls or the chair or the blocks is that when we move from standing down to hands and knees or kind of move through the standing poses, rather than forward folding, which could be potentially kind of compromising for you depending on where you're at and how your vertebra in your cervical spine and back are reacting to chemotherapy, we are going to always move through these poses by bending our knees, putting our fingertips to our blocks, and keeping the heart in front of the nose. So as I kind of bend down and touch into my props here, I'm going to pay attention that my heart is staying in front of my nose. I'm not going to be rounding my back. And so I want you, as we move through sequences in videos, to also keep heart in front of nose, fingertips to the blocks, or it can be fingertips to the edge of a chair. You do not need to go buy yoga blocks, right? It can be fingertips to the paper towel rolls, but keep the heart in front of the nose. And then we'll be moving, say, our leg back from there, any amount, and bringing our knee down. And just as a demo, that's how I would get you from standing to hands and knees safely. And then to transition from other poses too, I just want to make note to always move carefully. Put your stronger side on top. If I'm lying down, say we're lying down in a pose, and I want to bring you up, I want you to have your stronger arm on top. A lot of times we have surgeries or things that might compromise one side of the body. Have the weaker side down and the stronger side up to help you come up from the floor to seated. And then finally, having a yoga bolster or a couple of pillows off of your bed can really help to modify the practice too. We tend to end class with a few minutes in a chill out relaxation pose. So these are generally probably going to be used for that, but might also be used to slide under your bottom for Seated poses. Seated poses can always be done from the chair too, and just progress at your own pace. And feel free to reach out to me with any questions additionally that you might have about the practice, the props, the method, and I look forward to having you practice with me live or on a video download. Thank you so much for watching this short intro.